The pharmacy profession has evolved over the past century to provide the right care to patients when and where they need it. Another opportunity for evolution is on the horizon in the great state of Wisconsin: pharmacist provider status.
In the early part of the 20th century, there were few medical treatments, and the primary role of the pharmacist was the creation of custom compounded medications. In the middle of 20th century, the number of available medications grew exponentially, and many became commercially manufactured. Pharmacists transitioned their roles to become managers of an increasingly complex drug distribution system. Yet at the same time, community pharmacists were actually forbidden to talk to patients about their medications, and hospital pharmacists were relegated to the basement out of sight. Continued growth in healthcare complexity necessitated the expansion of specialization in medicine and the continued development of allied healthcare professionals. During this time, the pharmacy education advancement to the Doctor of Pharmacy degree, and postgraduate residency training and specialized board certification became more commonplace for pharmacists. It was quickly realized that pharmacists were trained as medication experts, and they could educate patients and their caregivers on how to properly take the medications and what potential side effects they could be aware of. The state of Wisconsin realized that pharmacists help achieve better vaccination rates across the state by providing the vaccines in community pharmacies. In the hospital setting, pharmacists proved themselves essential members of the healthcare team by focusing on accurate antibiotic dosing and monitoring, among many other medication-related aspects of patient care.
As science continues to advance, people are living longer with chronic conditions, and medication therapy has become the cornerstone of their ongoing disease management. As of 2016, the U.S. now spends $300 billion on medications, or 10% of all healthcare spending. Yet the U.S. spent even more, over $500 billion, or 16% of all healthcare spending, on the side effects, drug interactions, and illnesses caused by those medications. Pharmacists can decrease this costly, ineffective care by providing medication therapy management while performing office or virtual visits with patients and their caregivers. Pharmacists are the most highly trained members of the healthcare team in medication use and are the medication use experts. Pharmacists in many settings have continued to develop their role and have grown into medication therapy managers who take accountability for patient outcomes and work as part of interdisciplinary healthcare teams. Already, laws exist that allow pharmacists in Wisconsin to work under a collaborative practice agreement that enables physicians to delegate appropriate aspects of care to pharmacists to optimize medication therapy for patients based on evidence-based guidelines. This allows physicians to have improved access for visits with patients and experience less burnout while having pharmacists practice at the top of their license.
Even though pharmacists have the available scope of practice as medication therapy managers, the lack of payment for this role makes it financially untenable and creates a situation where patients don't have routine access to the medication experts to assist them in their care. This can be addressed by achieving pharmacist provider status. This is a law change that recognizes pharmacists as a billable provider for Wisconsin Medicaid. Pharmacist provider status in Wisconsin will allow pharmacists to bill Medicaid for appropriate medication management and disease prevention activities with patients. Pharmacist provider status will only pass with the collective effort of pharmacists and pharmacy technicians across the state. It is up to us to create our future. We ask for you to support this legislation by sharing your enthusiasm for how pharmacist medication therapy management will help the quadruple aim of healthcare within your circle of influence and engaging with your legislators when prompted by PSW.